So good afternoon, everyone. Thank you for joining our concurrent sessions. This session is Stopping Older Persons Gender-Based Violence in Women 55 Plus Through Promising Practices. And the project short term is Stop GBV 55 Plus, which our speakers will give more information about. I am pleased to be joined today by two colleagues, Benedict Shefflin, who is Executive Director for the Canadian Network for the Prevention of Elder Abuse. Benedict has worked for the Canadian Network for the Prevention of Elder Abuse since 2015 and became the Executive Director in 2018. She's originally from Avignon, France. She now lives in the unceded and ancestral territories of the coast of the Salish peoples, including territories of Musqueam, Squamish, and the Tellish Wamish nations, known today as Vancouver. Benedict previously worked for the BC Law Institute and its division and the Canadian Centre for Elder Law as Commission's Director before dedicating herself to the CNPEA. I have the great pleasure of working with Benedict on many of initiatives, including this one, which I'll be starting with. So she was also, they were also spearheaded the Future Us that Margaret talked about earlier today. She is also joined by Jessica Shea, and Jessica is a PhD candidate at the social work, at the Faculty of Social Work at the University of Toronto. She's also the project manager for this project that we're speaking about today. She received her Master's of Social Work degree with a specialization in gerontology from U of T and an honors of Bachelor of Arts from York University. Her PhD research focused on elder abuse of persons living with dementia by adult children caregivers. She has experience working in research project management and most recently led diverse range of research projects focusing on elder abuse within the community, its impacts of the opiate crisis among seniors, palliative care education, financial literacy, knowledge mobilization among older adults, and lastly, human trafficking of elderly. So we have great expertise here today to share their project and how this relates to the work that we're all working to prevent the abuse of older persons. So without further ado, I will allow you to go, and we will, this session will end at just 2:50, just a little bit of a change in our time, just 5 minutes later. We're just shifting things. So I'll turn it over to you. Thank you.
Thank you, Rayanne. Before I start with the presentation, I just wanted to restate the names that Rayanne struggled a little bit with. We were talking about the territories of the Coast Salish peoples, including the Musqueam, the Squamish, and the Tsleil-Waututh nations. And I'm very, very grateful to be present today, even remotely, and to be invited to speak. So thank you, EAPO, for having us. Please do give us a signal if we're threatening to go over time. I will do a very brief introduction of CNPEA for those who do not know us. We, CNPEA, the Canadian Network for the Prevention of Elder Abuse, is the sole national network, a pan-Canadian network that focuses on the prevention of elder abuse. Our mission is really focused on awareness raising, public education, knowledge sharing. So we focus on connecting people in organization, fostering the exchange of reliable information that is through our hub, CNPEA.ca, and advancing program and policy development on issues that relate to the abuse of older people. So when we take a step back, it involves also generally kind of providing opportunities to rethink, reshape the way we view and incorporate aging in our communities, in our society. I think we all now understand the importance of understanding and countering ageism to lead to better outcomes across the board for older adults. And we're really, excuse me, focused on building a holistic approach to prevention and intervention and support across the country and across sectors. My apologies, I'm recovering from the big C, the C19. As I mentioned, our knowledge sharing hub might be something that you are interested in. It's CNPEA.ca, where we gather and curate resources, reports, work, initiatives taking place across the country relating to the abuse of older adults to ageism. It is meant to be a kind of a one-stop place for people to find the information they need. We also offer regular free educational webinars that are related to the protection of rights, ageism, elder abuse prevention. We play an advisory roles with many projects and initiatives by other stakeholders. And we, of course, lead our own projects, the current one being the Stop GBV 55+, which is what we're going to be talking about today. And as Rayanne mentioned, and Margaret McPherson, if you were listening to her earlier this morning, we've been really focused on Future Us, which is our community engagement strategy on elder abuse prevention, which we launched last year. We're almost coming up to the 1-year anniversary already, and it has become a bit of a cornerstone for everything we do. As for the Stop GBV project, we're going to get into it very soon, so I will not spoil it just yet. Just to establish a couple of things, of course, I think all of you present today know this, but when we talk about elder abuse, we're usually referring to the definition of the World Health Organization, a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. And that usually involves an imbalance also of power and control in the relationship, whatever it may be. I will very lightly skim, like very quickly pass over the details on the types of abuse. I think, again, you're all quite familiar with them: physical, sexual, emotional, financial. I've included them for the purpose of, if you access the slides later and you wanted to have a point of reference, I'm very happy for you to have this, of course. We also consider, violation of rights and freedoms, such as interfering with spiritual practices or withholding mail or withholding access to visitors, as something to consider as part under the umbrella of abuse. Neglect, as well as systemic abuse, also known as institutional abuse. Of course, prevalence, we have some very knowledgeable people today that have contributed to the gathering of data around this issue. It is known as the invisible crime. We do not have as much data as we wish we did on the topic. For many years, I think the most cited resource was a 2015 national survey on the mistreatment of older Canadians that identified an aggregate prevalence of about 8.2% of Canadians over the age of 55. Since then, in 2022, excuse me, the Canadian Longitudinal Study on Aging has provided a more up-to-date number, which is 1 in 10 older Canadians experiencing one form or more of mistreatment or abuse each year. Oh, my bad. I scrolled down too fast. In terms of risk factors, again, identified in the longitudinal study on aging, the experience of mistreatment as a child or a youth is a risk factor, as well as any increased vulnerability, either related to physical, cognitive, or mental health status, shared living arrangements, or living with somebody who is financially dependent, identifying as Black, and being a woman, which is one of the reasons why we're focused on our current project. And in 81% of reports, it is a spouse, a family member, a friend, or an acquaintance that is causing the harm. And when you're looking back at recent data, again, around family violence against older people, the rates have increased noticeably from between before the pandemic and after. So family violence against seniors was 14% higher in 2021 than before the pandemic in 2019. And again, women accounted for nearly 6 in 10 older victims. And it becomes really striking when you start looking at numbers, particularly of femicide. Between the period of 2018 to 2020, older women represented about 1/3 of all women and girls killed by violence in Canada. So this means that they were overrepresented in the numbers of femicide victims during that period. And the Canadian Femicide Observatory for Justice and Accountability did make several recommendations, and one of which being to prioritize the monitoring, research, and prevention focused on older women, given those growing numbers. And so this brings us to our project today. As I said, these figures, which are being confirmed with every new report or round of data made available. These figures are why we initiated our project. So it started in 2021. It's a 5-year nationwide project that is funded by Women and Gender Equality Canada. It is the main goal is to strengthen support for older women and gender diverse people that are experiencing gender-based violence by developing promising practices for service providers who assist them. So the identified final tools that we aim to develop will have an intersectional lens. They need to be person-centered and be trauma and violence informed. Because what we know so far, based on the work we've done, is that, this is most screening and intervention tools have been designed for younger women. They don't necessarily address the specific needs of women who are 55 and older. And older women are themselves a generation that has consistently been missed in communication when we're talking about prevention efforts around intimate partner violence, consent, sexual violence. So it's important to focus our efforts on this. One thing I mention briefly is that through the project and as set out in the scoping review, which we're going to talk about today, when we use the term women, we use it in the most inclusive sense of the term to include people who are female as determined by their sex and people who identify as women, which is also when sometimes I will say gender diverse people as a alternative. We are very, very honored to be joined on this project by a group of diverse partners across many sectors who are representing shelters, transition and interval housings, violence against women, elder abuse, community supports, New Canadians organizations, and we really want to have that wide understanding of experiences across several intersections of identity and hear from people who are dealing with the issue or faced with the issue of gender-based violence from different angles. So as I mentioned, we're still kind of in the early stages. We went through a really thorough scoping review step first. We're now currently working on step 2, which is the development of assessment criteria and consultation with service providers. So we'll soon be connecting with a variety of senior service providers and frontline workers across Canada who have experience supporting survivors of IPV and family violence, and as well as victim support sector, elder abuse prevention. And we want to hear from them about, the tools they use, whether what challenges they encounter, how they assist older women, what is their experience. So we're about to get into the thick of it really soon. It's always a bit odd trying to talk about a project as it's still underway, but we did find some really interesting, things out of the scoping review. So we're going to get into this today and kind of give you a sense of where we're at and what we found out. And for this, I'm going to let Jessica take over and tell you a bit more about how we carried it out and what we found.
Yeah, thank you so much. So as you can see, there are 6 phases in our Stop GBV project here. And we just recently wrapped up our first task of the project, which was the scoping review. So next slide, please. So the scoping review and the project as a whole sits at the intersection of gender-based violence, or GBV, and elder abuse because of its focus on women aged 55 and over. There are a lot of overlaps between the two. Both are human rights violations caused by harmful acts, which can occur in many different forms, such as physical, sexual, psychological, financial, and emotional modes of violence and abuse. Also, older women often face abuse from various family members in addition to their intimate partners. And intimate partner violence, or IPV, and family violence are both nestled within the broader framework of GBV, as IPV is actually described as a type of family violence. So prior to even starting the scoping review process, we had two goals in mind. And that was, one, to improve our understanding of the capacity of service providers to identify and respond to intimate partner and family violence in older women aged 55 plus, using screening and intervention tools. And two, to learn about what kind of tools were out there and being used. So we use these two goals to help us create our 3 research questions, which was on the previous slide, but you can also see under the objectives section here. So these 3 research questions, it went on to serve as the basis for our scoping review. And we chose to do a scoping review as our first step because we had a topic that was very large and very broad. And because of this, we really wanted to see what kind of research has been done in this area, what people already know about it. And then we take what we find, we narrow it down to some key things and concepts, and then we would apply that to our specific project to inform the work that we are doing. So next slide, please. Thank you. So just as a very quick overview of what's to come, a bit of a teaser. We found a total of 10,560 unique documents, and we were able to narrow that down to include 42 in the final scoping review. There were 33 screening and intervention tools that we found, and 5 common themes emerged from our review. But how exactly did we get to this? I'm so glad you asked. So to do a scoping review that focused, previous slide, please. So to do a scoping review that focused on intimate partner and family violence in older women, we really needed to first understand just how much of a problem this was. So we started by just looking at the prevalence rates. And the stats we found were pretty shocking. So we've highlighted some of the highest risk groups here. And so from this, you can see that in terms of intimate partner violence, 61% of Indigenous women have reported experiencing this in their lifetime. 67% of 2S LGBTQIA+ individuals, 55% of women with disabilities, 42% of Black women, and 26% of visible minority immigrant women. Sexual assault on women is also twice as high in Northern Canada, and family violence is 1.5 times higher in rural areas. So from this, we can clearly see that IPV disproportionately affects women of all ages, but that we don't know much about the stats for older populations, as it's severely understudied. Next slide, please. So this one is probably the least fun slide, so I'll try to get through this as quickly as possible. So how did we find the documents to be used for our scoping review? So we searched 12 different databases and we retrieved over 10,000 documents. The titles and abstracts were initially screened based on some pre-established inclusion and exclusion criteria. So for example, documents that were not in English or French, or documents that did not have a focus on older adults. So we needed to take those documents out. And once this was done, full text documents were reviewed based on some more specific criteria to help us narrow it down. We then also did a hand search of citation lists to make sure that we didn't miss any documents. And from this, we then had a total of 42 studies that were included in the final scoping review. And the majority of these were from scholarly databases, and a small handful were from gray literature sources. So we did also want to note that we looked for resources and documents on this topic that were in French, but there were none included in our final review of 42 articles. Most of these did not meet our basic inclusion criteria, as it did not focus on older women aged 55 and over. But our team and our project partners, we will continue to engage community stakeholders to learn more about any tools that are being used with French-speaking populations, because we know that they're out there. So in the end, we found 33 tools that were identified within these 42 articles, although only 6 were intervention tools. You can see the entire list of tools on the right side of your screen there. The studies came from 14 countries, although they were primarily from the US and closely followed by Canada. I'll go through the 5 major themes that we found very shortly, but first I just want to highlight a few interesting demographics that were of note from the articles we found. So first, on average, the large majority of study participants were Caucasian, so about 67%, with only approximately a quarter of participants being Black and just under 15% were Indigenous. And one study mentioned that its participants were French, Portuguese, Turkish, or Icelandic speakers, while 2 studies each examined participants speaking Spanish, Korean, or Chinese. The remainder and vast majority were English-speaking participants. And there were only 2 studies that mentioned non-heterosexual women, of which one study was specific to the 2S LGBTQIA+ community. And the other found merely just 4% of its participants were non-heterosexual. All right, so now we get to the main event. So we found 5 main themes that emerged from our scoping review. So our first theme that we found, older women were not the specific focus of these studies and tools. So women 55+, they were rarely represented in these studies of intimate partner and family violence, and they were even less frequently the primary focus of the studies. Our second theme, then there's a need for screening and intervention tools to address health challenges. So researchers found that healthcare utilization was fairly common, and many mental and physical health outcomes were also associated with women experiencing intimate partner or family violence. Our third theme, tools were used or developed to target some diverse populations. However, only a few examined intersectional identities at particular risk of GBV. And these included Indigenous women, 2S LGBTQIA+ individuals, Black or immigrant women, women living with disabilities, and women living in rural or remote communities. Our fourth theme, 2 or more tools were often used in combination. So the studies often employed 2 or more tools in varied combinations in order to help them identify multiple forms of abuse. So this would usually be done during their screening process, which would then be followed by the intervention. And fifth and final theme, these intervention tools should focus on social support and empowerment. So researchers have found that interpersonal relationships and different types of empowerment play a very important role in the outcomes of interventions. So there is a need for these tools to have a greater focus on these aspects of social support and empowerment.
Thank you, Jessica. That was great. And so this is where we're at, looking at the work that was accomplished, the findings that we just laid out for you, and what that means in terms of implications for research, for practice, and for policy, which are good to bear in mind, I think, to kind of inform our work and probably your work as well. So in terms of research, really what comes out most clearly is the lack of representation of older women in general, both in studies and tool development, and particularly when we're talking women in their 70s and beyond. So there's an even more noticeable drop-off. And the need to also focus research that's surrounding questions about cognitive impairment and dementia. We also noticed that there's a need for increased diversity and focus on high-risk groups, or what is considered high-risk groups due to the numbers we showed you earlier. So we're talking about Indigenous women, 2S LGBTQIA+ people, Black and immigrant women, women living with disabilities, or living in rural or remote communities. In terms of practice, clearly we need more available and widely used intervention tools, especially with a look to the health and social outcomes. So we're talking considering the physical and mental health challenges, whether that is falls, depression, substance use, anxiety, as well as for intervention matters of social support, like Jessica was just saying. So social connection, getting economic empowerment, better control on one's finances, access to finding and managing housing, all the elements that can help someone rebuild and strengthen after experiencing something so difficult. We're also looking, as the developing better pathways from screening to intervention, and the need to eliminate structural barriers to enhance mandatory screening in primary healthcare settings. As for policymakers, the one thing to keep in mind is the need to recognize older women as experiencing IPV and family violence, and sitting at the crossing of the diverse intersectionalities. So as I said, it is a big issue. It is a big project for us. We wish we had more for you. We've again summarized the key info in a more palatable format here. We're going to be spending a lot of time talking to people and leading some consultations along the way. And we are always happy to hear from people directly as well. So if you're listening today and you're interested in learning more, or you want to know how you can participate and have a chat with us, never hesitate to contact us. Our ongoing work right now, we've convened a group which we call Safe Spaces for Older Adults, where we've invited people who work in the 13, I repeat, 13 for all of Canada, sheltering programs that particularly focus on older adults. And the goal of this group is to hear from them, again, about their work, about what they observe, what they encounter, what tools they use, and kind of foster a community of practice that can exist long after this project is gone, but hopefully also be able to engage in those conversations that can help inform our project. We've been really excited to create this group and to have such positive, enthusiastic feedback. It's really something that I think was needed, and we hope that a lot will come out of it. Next steps is going to be a catalog of promising practices, and thinking through ensuring screening and intervention tools can meet the needs of older women, that they address diversity, intersectionality, and that they're adaptable for different sectors and environments to a certain extent, the overarching principles and practices that can be applied throughout different sectors. So as I said, this is the end for today. We will have a lot more to talk about in the near future, and we're going to keep talking about this project as we progress. If you are hoping to get in touch with us, our contact information is on this slide. You will also find the link to our website, www.cnpea.ca, as well as the link to Future Us, if you're curious to read about it and understand the bigger picture of what we're trying to do for elder abuse prevention in the country. The slides, I believe, will be made available by EAPO later on, along with the recording. So, and if you have further questions, you know where to find us. I think I see a few chat box and Q&A questions already, but thank you for your attention, and thanks EAPO for having us.
Thank you, Benedict and Jessica, for that great overview of your project. I think it's well needed because, we look at tools that we've been talking about today, but, looking to see if they actually are focused or developed for older women is, I don't know, obviously you've done that sort of review, and what, how do they need to be changed or how they need to be adapted, or developing something brand new is really important. We did have a question just asking about, is your goal to develop screening tools for older women experiencing gender-based violence in community or living in facilities, or both? So long-term care, have you thought about that?
Yeah, so our focus really is more on women living in the community, and it's really looking at promising practices. And I do believe that some of these promising practices can be adapted and can be applied in other settings, but the congregate living setting is like a whole ball of yarn, and we have made a bit of a conscious decision to focus on women in the community for now, because the reality is that it affects a lot of people in our communities today. And when we're talking about older people and older women, a wide majority of them live at home in the community. So that's the main focus currently. Who knows what the future will bring.
So I just have a question. When you're emphasizing the focus groups or your outreach to the 13 shelters, so is that only because those are the only 13 shelters that deal with older women, or is that the only 13 shelters that deal with just elder abuse? Or maybe you can explain that 13.
Absolutely. So it actually was born, it was almost a parallel work that we were doing that perfectly aligned, and sort of like the synchronicity was too good to ignore it. So we were curious to know how many shelters out there were specifically for older people, not even just older women, just older people. And we started digging and pulled all the information together. It resulted in an infographic that is available on our website. And it turns out that there are only 13 across Canada, and they're not evenly spread. So some areas have several, others have none. And they do not all cater to older people the same way. So some have safe suites, some are a DV shelter only, some are focused on elder abuse. Like they're very noticeable variations, but it is what's out there. And so we thought it would be really interesting to bring everyone together and hear things from their end, because it is a very specific small group of people after all. And it's interesting to hear what they're observing. So we brought them together, and this was as we were working on our scoping review, and our findings were starting to take shape. And we thought, maybe this is also a way to connect those two things, where we're going to talk to people beyond the sector of sheltering programs. But this was one that we thought could be a wonderful way to get started, and also where there's this potential for a longer term community of practice that can continue to share and exchange. And we had a meeting just this week, and one of the conversation was, well, I am updating my intake form, and I'd be curious to see what this person has in theirs, because she mentioned something I'm interested in, and kind of create that sense of community to be able to share and exchange knowledge, supports, and a better understanding of like the layout of the situation out there.
I think that's really important because, as both of us, I think, working in the sector for quite some time, that has been a very big gap. And I thought, as people mentioned today, in terms of housing is a barrier to leaving abusive situations, and if it's hit and miss, kind of only 13 across Canada is very slim in terms of resources and supports for older women, particularly, and having some tools to educate, and having, looking at across all shelter services to have the resources and training to make sure we're asking the right questions so we can provide the right supports, I think is so important. So such value in the project that you're doing. There was a question, did you find many women's shelters that take older women as well as younger, did you find many older women's shelters that take older women as well as younger women and families? So do they take them together, or are they just separate? I think there's a mixture, or maybe you can comment on that.
There are many, when it comes to shelters for women, there are quite a few as a whole. And yes, it is likely that some older women will find their way to, let's say, I don't want to say generic, but like a shelter that is not just for older people. Very often it is because they may not even know it exists. I was, as a matter of fact, I think during one of our conversation with the Safe Spaces group, somebody mentioned that often women found their way to a homeless shelter first, not because they were without a home, but because they were not aware of the existence of the women specific shelter for a situation of family violence or IPV. So they do exist, and older women can access those, but are these places the best setting for some older women? Are they accessible? If you have a limited mobility, or are they trained to deal with someone who may, after potentially a lifetime of violence, now be experiencing some cognitive issues due to the violence, not necessarily due to age, but due to the violence. So it's a matter of finding, asking the question, how can we do better to really kind of tailor a service that is more, that understands the specific needs that older women may have, and that is able to look at the situation slightly differently, because it's not the same experience.
Right.
So yes, you can go there, but it might not necessarily be the most ideal situation, which means that might lead to some people going back to the situation they were trying to leave, because where they went just did not quite fit.
Right. And so the goal is, after the assessment tools sort of developed, is to roll out that training across Canada, or within different areas, or train the trainer. And I know this is a beginning process, but has that been sort of discussed or talked about within your project?
Yes, it won't be a train-the-trainer system, but we're definitely going to kind of devise, for every step of the way, for everything we develop, we kind of want to run it past a pilot group to kind of test it out, poke holes, give us some harsh feedback, and help us improve it before we disseminate it nationally. In the end, this is something that we'll make available to across Canada. We're looking at building, an online accessible spot with all the resources, and be able to make that as widely useful as possible.
Great. Well, thank you. I don't see any more questions. I don't know if Jessica, if you have any other comments before we wrap up.
Yeah, no, I think that kind of puts a nice little bow on it. We're very excited about this project. There are a lot of different phases to it. There's a lot of different moving parts as well. And with our Safe Spaces group as well, they're able to bring up a lot of issues that maybe we haven't even thought about. So they can really help us guide our where the project is going to go. So it's very nice to see a lot of interest in it. The Safe Spaces group, we had sent out a survey just to see the interest in it, and everyone was so excited about it, and they want to be part of this. They want this to become a community of practice, and where we can kind of share ideas and help each other.
And the Safe Spaces, that includes older women themselves, or just service provider agencies?
Currently
Currently
only the agencies,
Okay.
But I was about to add, we're also hoping to connect with survivors a little bit later on, and kind of engage in conversation with them as well, to hear from their perspective and their end. So that's something that is also in the works.
Okay, great. Well, thank you both so much. And I encourage everybody to go to the website, find out more about the gender-based project. If you're not on the CNPEA's newsletter mailing list, please sign up for that on their website, because Benedict's great about posting information about not only the project, but other things happening across Canada. So she has that, the whole jurisdiction across Canada, what people are doing and the planning of other projects and things. So, and you can contact Benedict or Jessica by the email. So thank you both, and thank our ASL interpreters. I know there's a little bit of a break before we start our next session at 3 o'clock. So have a chance to maybe connect with Benedict or Jessica on the platform after this, as they need a little time just to get reconnected onto that session. If you have any specific questions, or if you want to get engaged or involved in the project yourself, I know they're always looking for some feedback, and if you have resources that they might not have known about, because we live in this big vast country, and there's lots of people doing things, and when sometimes we don't have the opportunity to share things amongst each other. So thank you again, and we will see you again at 3 o'clock. Thank you.
Thank you.
Thank you.